Thank you. Okay, great. We're expecting quite a few more people to join us, so we'll see them when they come in. Welcome and warm greetings from Let There Be Light International and our partner organizations. We expect them to be joining us shortly. My name is Sarah Baird, and I'm the founder and executive director of Let There Be Light International, a nonprofit based here in the US. Let There Be Light International's mission is to combat climate change and global energy poverty through grant-based renewable energy programming in partnership with local grassroots NGOs in sub-Saharan Africa. Our programs employ a gendered lens with a focus on women's health and empowerment to ensure that no one is left behind as we strive to achieve Agenda 2030. Today, we're joined by two of our key partners in Uganda. We're hoping there's been some connectivity issues, but we're hoping they'll be on momentarily. So I'm going to give you a brief introduction of who they are. Next slide, please. Caroline Mbwaza is an energy poverty consultant at Solar Health Uganda outside of Kampala. And Charity Swigi is a nurse, midwife, and implementation partner from the Chikonda Health Center 3. Caroline is a psychiatric clinical officer and an SDG ambassador for NET Africa and has worked as an energy poverty consultant for 3 years. She works on measurement and evaluation of Let There Be Light international programming and raising awareness about energy poverty or the state of living without access to safe energy and how it impacts women. Caroline is also an active member of Rotaract, where she's the treasurer of her local club and the incoming club secretary. And Charity is a professional nurse midwife. She's been practicing since 2012. She works in the Chankwanzi district in central Uganda, where she handles deliveries and offers antenatal care services. Charity is passionate about her work and says she's chosen by God to love and serve. I'm also happy to introduce Shreya Nathan. Shreya is excited about all things clean energy and loves the intersections with business, policy, and global poverty alleviation. In early 2020, she led an MBA team to rural Uganda to conduct a field project and impact assessment of our Safe Births Plus Healthy Homes program. She studied engineering at Princeton University before working as a consultant at the Boston Consulting Group in New York. She's currently in her second year of a joint MBA, MPA at Wharton and the Harvard Kennedy School. Shreya recently joined the board of directors of Let There Be Light International. Dr. Ben Kerman is a psychologist and program development consultant who works with nonprofits and foundations. He is joining us today as a moderator. Dr. Kerman is also a valued Let There Be Light International board member. First, a few housekeeping points, which you're probably fairly familiar with at this point. Please keep all your microphones muted during the session. Please introduce yourselves in the chat. You might include your name, affiliation, where you're joining from, and why maternal and infant health matters to you. We have 2 polls that we invite you to participate in. You can find the polls and cast your votes in the poll section of the event. We can share the results before the Q&A. And also, please put your questions in the comments section. We will have an opportunity after the panel to address these questions. Our goals for the session are that you come away with a greater understanding of how some of the challenges facing women giving birth in low resource off-grid communities are impacted by energy poverty, and how energy access is a key component in ensuring maternal and infant health positive outcomes. Safe Births Plus Healthy Homes is Let There Be Light International's signature maternal and infant health program in rural Uganda, with the objective of improving maternal and infant health by increasing attended birth rates and impacting indicators of women's empowerment through the donation of a safe solar light to new mothers for use at home after the birth event. Through this discussion, we hope to raise awareness about how SDG 7 impacts a wide range of SDGs, including women's health and empowerment. As you may know, SDG 7 calls for affordable, reliable, sustainable, and modern energy for all, and measures impact through energy access, increasing the share of renewables, and doubling energy efficiency. While Let There Be Light International's programming does not address energy efficiency directly, we work with our partners to increase basic energy access in low resource communities through a social safety net energy access model in which we facilitate renewable energy technology transfers to prioritized off-grid communities in Uganda, Kenya, and Malawi. I invite all participants to be active in this discussion through the chat function. And now I'll give you a bit of an overview of the Safe Births Plus Healthy Homes program. Safe Birth Plus Healthy Homes is a maternal and infant project which, number one, solar electrifies rural clinics offering maternity services in Uganda. Second thing we do is we train village health teams and clinic staff to raise awareness about the benefits of midwife-attended births at electrified clinics and the project's solar light incentive for new mothers who use the clinic for delivery. And the third thing we do is we donate solar lights to new mothers who give birth at the electrified clinics to improve health and safety of the family during the critical postpartum period and beyond. 4 clinics are currently participating in Safe Births and Healthy Homes in Uganda, with 2 more clinics coming on board in 2021. Our program goals are really to break down social safety net silos, focusing on the interlinkages between energy access and health and empowerment outcomes. We want to respond to local needs and opportunities and collaborate with local clinic staff. I'd now like to read a quote from Dr. John Bosco, who's a district health officer in the Changkwanzi district of Uganda, who has been instrumental in the creation and sustainability of this project. Quote, "On behalf of the health department and entire district community, I am happy that this project, which has been piloted in our district, is finally going to be scaled up. I'm hopeful that the project will further increase the number of births at health centers, which in turn will reduce the risks of maternal and child deaths. We welcome the idea and will be supportive in any way we can." And then this from a district health officer in the Gomba district, with whom we hope to work as we scale up Safe Births and Healthy Homes. Dr. George Chikwanuka says, "Oh, that's wonderful. Many pregnant women in our district give birth by themselves or go to traditional birth attendants for help, a factor that can put the patient's lives in danger. Such circumstances sometimes result in complications in delivery. By implementing the project in our district, many lives are bound to be saved." I'm now going to introduce Dr. Ben Kerman, who's going to be facilitating this morning's discussion so that I can contribute and listen more fully. Thank you.
Thank you, Sarah. Good morning, everybody, and thanks for joining us. Really appreciate the opportunity to not only share the Let There Be Light and Safe Births and Healthy Homes experience from all of these different perspectives, but also to get your questions and comments. There's some great expertise, and just peeking at some of the names and backgrounds. So keep in mind that this is a pilot project, and it's continuing to expand, but with each clinic, we learn more. With each partner, with each mom, frankly, we get feedback that helps us improve this project, and we're hoping that continues today. So do use the chat, as Sarah said. That is open for comments and questions. We're going to save time later in the session to pick those questions up. But while the quote she shared hit on a number of those key terms to keep listening for, certainly in addition to piloting and scaling up and ideas for how to scale up and scale up successfully, we heard about the risk to moms, we heard about risk to babies, and we heard the enthusiasm for this project that we all share. So what we're going to do is we divided up the session to hear from our panelists, who I think have been joined us, but we'll make sure as we move along. And what we're going to do is we're going to start each of 3 sections with a little animation that Let There Be Light and Safe Births and Healthy Homes team used to introduce the project, both to audiences in the catchment areas, as well as to funder audiences and others. So we wanted to start with that. The first one will talk about the clinics and will help us focus our discussion about the impact of lights on the clinics and the care provided and the empowerment of folks there. The second will look at the impact on the community and the outreach to the community to increase the rate of attended births. It is a very significant problem that has been prioritized by the health ministries. In some of the rural districts, the rate of unattended births is as high as 70%. That's a lot of risk. And then the third of the animations will look at the impact on homes of clean light and clean solar light, the impact on the family, the whole family. So we're going to divide it that way. Then we'll move to the questions and comments. Please keep them coming. But with that, I'm going to advance to the first of these animations.
Hello, I'm Nurse Grace from Uganda. I love serving my community, but I've been nursing without electricity for too many years. Can you imagine caring for someone in the dark without power? But people count on me to keep them healthy and safe. So I have to use kerosene or my phone to assist during emergencies. Like clinics everywhere, we need reliable power to provide healthcare. Great news! Working with local and international partners, electricity is coming to our rural clinic. We can't wait to stay open 24 hours and provide better care to the community. Today, we're receiving solar energy. Look, the electrician has arrived. This is a big day for everyone. Soon, we'll have safe and strong light. I'm so proud to be working in a modern clinic now. Together, we all can shine on and let there be light international.
Thanks. So again, that's a short video that's used to increase awareness among in the catchment areas, as well as with audiences like this and with donors and other programmers to give a quick view. I'm going to now invite some follow-up comments from two people who know the program very well and know what happens in the clinics, like the one in this picture. Carol, do we have Carolyn and Nurse Charity? Are you guys on the line? Please check and see to that you're unmuted. Let's see.
Carolyn is with us. Carolyn, I know you're in Uganda. Are you able to unmute yourself?
Yes.
Welcome, partner.
Thank you so much for hosting us this morning. Solar electrification, we are glad together with Let There Be Light International, we have solar electrified 50 health clinics, and it involves, it's quite a process. It involves working with the district health officials, the DHOs. So we connect with the DHOs. The DHOs help us to identify the health centers within their districts that are in need. And that these DHOs, they head their health departments in all over the districts. So they're able to avail to us the health centers that are in need, and that the in charges there, and we carry out a pre-electrification survey. This pre-electrification survey helps us to establish the status of the health center, and it also helps us to establish which health center to prioritize. After which we contact competent electricians that do carry out the solar electrification of the health center. After which we carry out, after the electrification, we carry out a post-electrification survey, and this helps us to assess the impact the solar electrification has done on the health center.
Carol, I know that Nurse Charity has not been able to connect yet, but will be joining us later and will be able to speak to the complications of being a midwife and helping women deliver in clinics that are unelectrified. But perhaps since you do so much of the data collection and analysis of the safe births and healthy homes, you can speak a little bit to the complications of women coming to unelectrified clinics, as well as the complications of choosing to deliver in the community, which, although is a traditional practice and completely valid, sometimes does put the mother at risk and the baby at risk. Maybe you can discuss that.
Okay, thank you so much once again. So some of the complications, because here in Uganda, just 15% we have population that has access to clean energy, that is electricity, and basically 8%, and this 8% is mainly in the rural areas. So a health center without electricity, and a woman comes to deliver the health center without electricity, it's really quite hard for the midwives, because usually per se at night, the midwife may be in fear of coming out to come and attend to the woman that has come to give birth, and also a woman that is pregnant to come to a health center that is not electrified. It is really hard for that woman to come, since the health center is not electrified. But if it is electrified, it is really easy for these women to come and access the health center even at night. So it becomes really hard for them to come when the health center is not electrified, and also it becomes hard for the midwives still because of fear. And then at times when they're handling those deliveries at night with no lights, at times they use the battery torches. For those who have, at times they use their phone torches, and some of them use candles or kerosene lamps, which is really not good, and provides a light that is not reliable, or it's not good, or does not enable them to carry out the delivery at the health center. So it becomes a challenge to them. And also the mothers, some of the challenges the mothers have within the community that really leads them to go to deliver to the TBAs, the traditional birth attendants. Some of them are the extreme levels of poverty within in the country, because though these health centers are public health centers, there's still some costs involved, and which really times limits these mothers to go to deliver the health facility. Another challenge we have is the transportation. Transportation in terms of costs, and also transportation in terms of the means of transport for these women to come to use to go to the health centers, because in these rural areas, few of them have health centers have ambulances, and even those who have ambulances, some of them may not be working or may not even have fuel in them. And a woman that has experiences who is pregnant and wants to deliver, especially at night, so it becomes really very hard for them to travel, since most of the means of transport in the village, it's motorcycles that are available for them to travel. Another challenge with the untended birth, we have the influences. These influences might be from the relatives, say the husbands, the mother-in-laws, maybe the mothers to the pregnant women, that at times influences them to go to deliver with the help of the TBAs. And at times they have no say, but they go with the influence of their relatives. Another challenge would be the cultural beliefs. Basically, there are some cultural beliefs that when you go to deliver with the help of the TBAs have herbs that help mothers ease the process of delivery. So at times, the pregnant women go to them with that belief that the TBAs will give them that herb and eases the process of delivery. So another challenge is
Well, Caroline, I'm sorry to interrupt you. Hang on to that a challenge, because I know there are many, and before we go to the next video, it's going to help us look at the mom's experiences. I know I'm so sad that Nurse Charity is not with us, that the technological connections were getting in the way today. Because one of the interesting things that she and I've discussed in the past was that the impact of lighting isn't just, it's definitely helps increase the access to healthcare because the clinic can stay open longer. And that helps both moms and the whole community, because the clinic is really a gathering place and a place of care for many, many families. So it has a tremendous kind of ripple effect that way. But one of the things that I found surprising as I've been learning more about this was that the lighting also improved care by improving the living conditions for the people who work there. The working and living conditions were, it was very rewarding and for the people who lived at the clinics to have lighting themselves, to have clean lighting. And that made these posts that were often in remote rural settings more satisfying professionally for them. And it decreased staff turnover, which increases the quality of care. So I thought that was another interesting kind of impact. I'm going to switch. I'm going to go to the next animation. It's going to help us look a little bit more closely at where Caroline was going, which was, what's the mom's experience?
How can solar lights change lives? Meet Teresa. She lives in a rural community in Uganda and is about to give birth to her second child. Without access to electricity, Teresa uses polluting and dangerous kerosene to light her home. In Teresa's village, there's a new maternal and infant health project called Safe Births and Healthy Homes. Safe Births and Healthy Homes Solar electrifies community health clinics and donates solar lights to new moms and babies. Nurse Charity welcomes Teresa to the maternity ward at the local clinic. The delivery is a success. Teresa returns home with a donated solar light to keep her and her new baby safer and healthier. Shine on and let there be light international.
I think we had a little technical difficulties at the end with that, but it looked great. Thanks, Ben.
So So yeah, sorry about that. We saw some of the, in cartoon form, we saw some of what Caroline was talking about there in terms of the traveling to the clinics and the advantages of light. Caroline, I'm going to invite you and also Shreya. Interviewed a number of mothers, both individually and in groups. Um, what are the issues in terms of trying to help the ministry increase the rates of attended birth through safe births and healthy homes? You'll have to unmute either of you. Anything about using the solar lights to help encourage moms to come into the clinics?
Ben, I'm happy to jump in. Could you repeat that? I think your internet was a little choppy for a second.
Oh, I'm very sorry. I was hoping that you, Shreya, and Caroline, and Sarah, of course, could speak to some of the impacts as well as some of the challenges when trying to use lights and the care in the clinics to bring moms in, to encourage them to have attended births. So what are some advantages? What are some of the challenges?
Yeah, I'm happy to start to give Carol a quick break. So for reference, we were on the ground in Uganda just about a year ago before everything shut down, and we're able to meet a lot of these moms and understand what their journey was like. There's so many far-ranging impacts. We were mapping out as consultants the first order, second order, and then longer term impacts as to what one simple intervention of having a light during birth can do. And I can speak to some of them now. So on the first order level, I think the mothers are able to better care for their baby at night. They can then bring the light home and safely use the restroom after dark. Their children will often have more hours to complete schoolwork, which they wouldn't have otherwise if there wasn't a light in the home. There's some really wonderful gender empowerment, women's empowerment that happens when the mother brings home the light, which is something that she uniquely is contributing to the household, and gives her a bit of leverage and equality with her partner. The mother is able to spend more time on other kind of income generating activities. Many of them have hobbies and weave in their spare time. And with both the children able to now study more with the light and them able to work on those activities at night, there's more activity sort of across the board and more hours, productive hours in the day for everyone. Just a couple other ones that I can think of is the overall family health improves because the lack of use of kerosene prevents some of the respiratory issues that are associated with that. And it improves malaria bed net usage, which many families are scared to use in advance of or before, when using kerosene because they're extremely flammable and that can be scary. There's a lot of burns and fire risk. So lower malaria, higher and lower respiratory issues. And then just overall, a lot of the women spoke to just a greater feelings of safety and security for the entire family, just knowing that the light was reliable, that they weren't going to be spending up to a third or a half of their weekly income on kerosene that was, flammable and dangerous for their family, but rather they could, there was a peace of mind for sure that came with bringing the light home. And this is all just after it comes home from the clinic, let alone the experience itself at the clinic of giving birth with real light that the first animation talked about.
Yeah, thank you. I'm going to jump in there quickly. Again, I'm executive director of this organization, but what I really wanted to say thank you, Shreya, for bringing up all these incredible add-ons that we were not expecting until Shreya's team went to do the impact evaluation, especially around women's empowerment and the bed net usage, which is one thing that we hear again and again in the field is women, especially moms, will tell us that they are willing to not use a bed net because they're afraid of fire, which in many cases is a completely reasonable calculus. They tell us, we don't mind having malaria again. Everybody has malaria, but we don't want a house fire. So that's been a really interesting knock-on effect of the Safe Births and Healthy Homes. I think it's also great to reiterate that what we're trying to do is increase attended births through an incentive program. And this was in response to requests in the field. We already were solar electrifying clinics. We already were donating solar lights to prioritized, vetted, vulnerable families. But when the district health officers, in a very creative way, asked us to combine these programs to try to move the needle on maternal and infant health, we really saw an extraordinary opportunity, because there's many programs that are electrifying clinics and recognizing the maternal health impacts. But there are unfortunately not the next step, which is when you send the new mother and baby home after the birth event, what then? And so that's where this project is innovative, in that it's the Safe Births plus the healthy homes, which we find critical. So Caroline, would you like to talk a little bit about how the village health teams are trained, how they're going into the communities and telling the new moms about the opportunities? If you could unmute yourself.
Okay, thank you so much once again. Safe Birth and Health Homes, besides solarification of the health center and then the light as an incentive, there is also a component of outreach and education, which is done by the VHTs. So we do train the VHTs. We get within the community where the health center is, we get the VHTs, and we train them. On, some of them help us conduct the follow-up surveys. So we also train them we train them to go out in the community and raise awareness about the project, and also about the benefits of using solar, and also the disadvantages of giving birth within the community. So they are empowered during the training, and we also keep in touch with them. We keep talking to them and also encouraging them. And they keep going in the community. They talk to the women, the pregnant women, about the different importances like of antenatal care, going to the health center for the antenatal care. Also, they talk about the project, and also why they need to go to the health center and deliver from the health center with the skilled health professions. Yeah.
Great, that's wonderful. Our moderator apparently got bumped off for a moment, but he's coming back. The joys of Zoom. There we are. All right.
I'm on my way.
All right. Well, this is also an interesting programmatic issue that we deal with on an ongoing basis, is the communication. So we're really pleased that we have one of our partners on, because it's not always that fluid. I think that Ben, are you moving on to the third animation?
Yes. Sorry, everybody, again, but that, as Sarah said, that is like that is a real condition of the work. So yeah, so the third animation will kind of help us talk a little bit more about the impact at home. We've already heard about some of those impacts, but maybe we can go a little deeper.
Many people around the world must rely on dirty, dangerous, polluting kerosene for light. Let There Be Light International donates safe solar lights to vulnerable families in Africa.
Solar lights are changing lives. Join us at Let There Be Light International.
Great. Again, that's a way that we should talk about the program, the impacts, and perhaps we can also hear a little bit more about that awareness building work, because Safe Births and Healthy Homes is about a direct service project, but it's also about advocacy around the issue more generally. Before we do that, Shreya, you started to talk a little bit about the outcomes that you saw when you visited the homes. You know, one of the things that I'm struck by is how one intervention can have an impact on multiple kinds of multiple aspects of life. Can you tell us a little bit more about that kind of whole impact, or the multi-dimensional impacts that you saw?
And maybe also with a little bit of a description of some of the homes. For instance, I believe these two pictures were taken by you and your team. Thank you.
Sorry, Ben, you're asking about, you want to talk about further than the first order impacts, or?
Yeah, well, you saw that that homes could be affected in many ways. Some that were, social, some that were financial. So just inviting, because one of the things that is a current topic is the interlinkage among the different kinds of impacts that we're trying to promote, so that we're not really specializing in one kind of thing, and that we can all see the connections between our different approaches to addressing poverty and other challenges to good outcomes.
Yeah, absolutely. I mean, I love interlinkages. I think I mentioned a few sort of in listing out some of the direct effects that come from bringing the light home. I think we were able to extrapolate these out and tie some of them to the UN Sustainable Development Goals. Sarah mentioned a few, but there are relationships to 1, no poverty, 3, good health and well-being, 5, gender equality, 7, affordable and clean energy. There's a lot of really strong effects. And some of the ones I can call out now, 1, just improved energy affordability at a very basic level through the use of the small Pico light that we give to the mothers. They are no longer reliant on kerosene lamps. And when we ask them to sort of map out their budgets and what their household looks like, that is a savings of a third or a half of their income every week, which is massive. And so with that then comes improved financial resilience. So there are cost savings from the light that they can now put towards school fees for their children, for necessities for the household. Plus, in addition, there's that extra time that they can use to work on hobbies or other income generating activities. Some of them own a store and are able to open that up at night, which is huge. Some of them do crafts and can sell them at the market, and they're able to make 2 or 3x the number with those extra hours at night. So 2 would be improved financial resilience. The third one is just overall health and wellness. I think mothers and their children are less susceptible to injuries and burns from the kerosene, to respiratory problems from burns from the kerosene, respiratory problems from the kerosene, and malaria that comes from not using the bed nets because of fear of fire due to the kerosene. So a lot of overall health and wellness. And I mentioned last time also just this overall well-being and peace of mind that comes with it. And that's really hard to overstate, I think. A couple others that I can call out, improved standard of living overall. With the use of these solar lights, the mothers are less stressed with a bit of financial cushion. They're happier, they feel safer, they feel their children are safer, they're less fearful of small things like using the latrine out at night and stepping on a snake or sending their kid out to do the same. And they enjoy just overall improved standard of living. So that one is a big one. The last 2 I'll call out, 5 and 6 are improved women's empowerment. And to Sarah's point earlier, this is something that we didn't at all expect to find, but in doing lots of, we spent several days interviewing many of these mothers. We took the pictures that were on that previous that previous slide and got to meet them. It was an exhilarating experience. But these mothers, once they become the owners of the light, are, you know, pun intended, sort of seen in a different light by their husbands. So they can be more receptive to the woman's thoughts, her decisions, because she comes in with a bit of leverage after the birth. She comes in not only with the baby, but with this incredibly powerful, you know, sort of life changer for the entire family, for their health, for their well-being, for their education, for their finances. And so that one we're excited to dig more into to understand what those effects look like. But there's really something interesting and powerful there. And then the last one that I think I alluded to earlier is improved education. So for multiple reasons, both better financial resilience on the parents' part and ability to pay school fees, which is a big part of it. More time for children to study and read in the evenings, which allows them to do better and stay in school. And then just less incidence of health problems that will also be factors that keep them out of school. So for three reasons that were related to the earlier points, there's also an improved educational outcome with the lights. So some really powerful and strong linkages as we think about one little light during a birth and how it impacts almost everything in the family's life and for all members of the family was really amazing to see.
Great. Thanks, Shrey. Sorry about the musical slides there. I lost, unfortunately too, I when I got kicked off, I lost the chat history. So if you had submitted a question, I will, hopefully the questions I ask now will reflect your interest, but please resubmit if there's something out there. I know, and this is, I invite Sarah, Shreya, Caroline. You know, I know one thing that we're all thinking about these days is the pandemic and how the pandemic has impacted your work, this approach. Are there any adjustments that you have made to this work to kind of cope with the pandemic?
I'd love to jump in on that briefly and then pass it off to Caroline. So from a programmatic overview perspective, we at Let There Be Light International, we do a great deal of a whole variety of different kinds of solar light distribution. So Safe Births plus Healthy Homes is a really important project of ours, but we also focus on school children and elders, people living with disabilities, and and typically we would do that through some community-wide distributions in which education and follow-up were really critical. The pandemic has forced us to rethink a lot of our programming, and in fact has opened up an opportunity for us to expand Safe Births and Healthy Homes, because the women are receiving their lights not at group distributions, but at the point of birth. And so our pulling back from some of our other distributions, because we typically are donating about 5,000 lights a year and solar electrifying about 8 clinics. We're now solar electrifying more like 12 to 15 clinics, and we're doing a lot more with Safe Births and Healthy Homes, in which the midwives and the village health teams and the communities themselves are taking ownership for these programs. And I think that's been a really exciting evolution for our nonprofit, partially because we get to hand off a lot of the programming to the local communities, and whereas we're still fundraising and doing a lot of advocacy and outreach, we know that the professional capacities of the local communities are really in line with what we're trying to achieve. And so the pandemic has been both an opportunity to rethink our programming, but also an opportunity to scale up Safe Births and Healthy Homes. I will pass it off to Caroline to discuss a little bit about the pandemic's impact, but I'd also love to hear a little bit about some of the follow-up that you've, now that, so a new mother receives a light when she comes to give birth. She goes home with the light, hopefully has had an improved birth experience. And then at the 10-week vaccination point, she's coming back into the clinic, and the village health teams are resurveying them, the moms, and finding out how the lights are impacting them, what their birth experience was, trying to gather some information. So Caroline, if you could address for a few minutes the pandemic and how it's pivoted programming, and then also maybe talk a little bit about the follow-up at the 10-week vaccination point, and then we'll open it to question and answers.
Thank you so much once again. The pandemic, the COVID-19, I would say it affected generally the whole world, and also affected our work. As you know, the lockdown and everything has really changed, and therefore we had to also increase our capacity as the consultants, as the people on the ground, increase our capacity and support more programming, and also increase on our capacity to collect more data, so that we may be able to show the impacts of the projects. So basically, the COVID has enabled us to increase on our capacity in a lot of different ways, in collecting data in order to show the impacts to the people, and also it helped us to rethink more ways, more approaches on how we can reach out and show more impact to the people of what the project is doing. And for the follow-up of self-birth, it usually takes place at 10 weeks. When the mother goes after delivery, like Sarah said, the mother comes back after 10 weeks during the immunization. When they come back for the immunization and 10th week of our baby, and then we have trained VHTs that do carry out or conduct this follow-up survey. They ask them about the solar light and how has it impacted them, their family, their health. Ask them about economically, any impacts economically, as generally as a family, how this light has really impacted them.
Caroline, I think you pointed out that even though the pandemic was a real challenge, it also created opportunities to do more, some kinds of the work more, and to work on the data collection. And Sarah, when we talk about the data, how helpful is that to you and in your part of this work in trying to scale it, work on supporting the work that's in the field, but in the communication and awareness building work that you do? What is it going to take in addition to data to help scale this work?
Well, thanks, Ben. I think what we want to get, the message we want to get out to other people working on maternal and infant health and women's empowerment is this is a really low-hanging fruit. It's an easy way to help immediately and directly impact women's lives who are living in low-resource communities. We're not advocating that Let There Be Light International would be the NGO to implement this. In fact, we're asking for those groups that are already working in some low resource communities to recognize the interlinkages between energy access and maternal and infant health. So we're asking that you can come learn from us. Certainly, we're happy to advise with you. We'd also, of course, love your support. But we really are hoping that other NGOs and organizations and even for-profit enterprises will recognize the necessity of basic energy access as part of a social safety net program. So whether you're doing water or education or female health and safety, that gender-based violence issue, light is almost as basic as food and water and other things that we consider basic. Unfortunately, what has happened in the history of energy access is it's always, not always, but it's frequently monetized, so that if there are projects to get people to have access to energy, it's almost always done in the context of entrepreneurship. And our argument is that a mother with a new baby needs to have basic and safe energy access at home as a critical health and safety input. And it is not necessary to always monetize it. So we are asking for people to join us as advocates, as practitioners, and that would be really the thing that I would like to get to put out there. I hope that answered your question.
It did. And are there any examples of that, of others being able to kind of integrate some of these ideas or some of these practices?
Sure, there are several different NGOs and nonprofits that are now starting to integrate energy access into their programming. We have not yet partnered with or supported other nonprofits that are working on maternal and infant health, but we've got a great project that's launching in the next few months that's working on elder well-being and elder health. So that's in the western part of Uganda, and it's a group working through working on elder mental health and physical safety. And they, after working with us, they implemented a couple projects with us. We helped them do that. They are now considering it part of their core programming. So we're really excited to see that, because where there's over 680 million people living without access to basic energy. And this is certainly an opportunity for a lot of the businesses that are looking to roll out mini grids and rent to own systems, but it's also, we believe, a critical opportunity for nonprofits and other people working in the social safety net space to recognize that solar lights and the cost has come down by about 15 times in the last 10 years. They're very affordable, and they provide an opportunity, a low-hanging fruit, to impact health, safety, empowerment, and a host of other SDGs, as Shreya and Caroline have been mentioning.
Great. I'm going to squeeze in one more question. I just got one in from the chat, and the question, so I'm going to ask the panel to perhaps Sarah and Shreya, if you want to add. The question is, can you say a little bit more about the data collection and this notion of primary impacts and then the secondary impacts? Where is the data collection heading? What have you found useful? And what are we going to know more in the coming year?
I think Caroline, if you're still with us, if you've got connectivity, that would be a great opportunity for you. Otherwise, I'm happy to take that.
Hello. Please pardon the question, Ben.
The question was, what additional data will be collected and what more will we know, say, in a year from now?
I'm happy to take that if Caroline's having some connectivity issues. Also, I believe in the chat there was a question about, can you speak more to the data collection technique? So that is something that we have been very focused on since we began programming in 2014. We provide tablet computers to our partners. We actually, Let There Be Light has 10 grassroots partners in 3 countries. But when we're talking about safe births and healthy homes, we provide tablet computers to the participating health clinics so that they can implement a survey to the new moms, and that it's disaggregated for gender, income, disability status, but it also is looking at things like what percentage of your income are you spending on basic lighting? What is your income? How much do you spend on lighting? It's looking at questions about health and safety. So is anyone in your home experiencing respiratory distress? Do you have, has anyone been burned by a fire in your home? Bed net usage, things like that. So those, it's a fairly comprehensive but not terribly time-consuming survey that the health clinic staff will implement, and they are paid for their time to do that. And then the woman gets the solar light with the understanding that for the first year of usage, it actually belongs to the local health clinic or grassroots partner. And that is so that we can do follow-up on it and make sure that the light is not sold or not handled properly. And then at the 10-week vaccination point, we're asking follow-up questions that that help us understand what the impacts truly are, and we're able to use an offline or off-grid data collection app called the ComCare app, which is a wonderfully robust program application that that people can implement these surveys, and then when they have connectivity, that it is uploaded to a like a ComCare headquarters in which the data really cannot be manipulated once it's inputted, and then it is analyzed by an independent third party, and we then give the results back to the implementation partners so that we can together learn how to improve and modify programming to make sure that we are benefiting women and infants. So I hope that answered the question.
Yeah, thanks. Actually, and Shreya, I know that when your group looked at some of these impacts, they started to quantify the return on investment. That was really interesting and starts building a pretty compelling argument as well, but that's not easy. Could you talk a little bit about the technique behind that, about the calculating returns on investment?
Yeah, sure. I think to Sarah's point earlier, there's a wealth of data to be captured, and it's exciting to see kind of the first steps towards that, given that no apps or other counting of this sort has happened before. So with the survey data that the clinic teams are capturing, and then with a lot of the anecdotal data points that we captured from visiting and chatting with a lot of the mothers and the nurses at the clinics, we basically tried to put numbers to those second order effects that I mentioned in my previous one. So the ones that I mentioned to recap were improved energy affordability, improved financial resilience, improved health and wellness, improved overall standard of living, improved women's empowerment, and then improved education. So if we take each of those, we did our best to put numbers to how much is a household saving, or how can you put a price on it, basically. It's hard for something like standard of living, but for some of the financial resilience, health and wellness, there are a few numbers you can put to them, and then the overall calculation then is just all of these over, what are the costs of procuring and distributing the lights, and that mostly comes from the cost of the Pico light itself, given that Let There Be Light is doing all of this kind of their own funding and sort of completely nonprofit. But we think about what is the cost of distribution, like those two are really the denominators. So when I go to those different types of
second order effects. I can call out a couple examples. For example, for improved energy affordability, we talked about how much is a household saving every year off of not spending on kerosene light, and that varied by household. But if you think about a third to a half of their weekly income, we translated those shillings into the sort of dollar value, and it came to like greater than 50 US dollars of savings annually, which is the comparison we need to make back to the Pico Light. When it comes to improved financial resilience, how many additional hours does a woman get to work in the evening, which she can contribute towards the income of the family in some way? It could be either, again, through crafts, through having a store open, et cetera. And that came to, I think your estimate was greater than 160 US dollars of additional annual income. So a huge impact there. If we look at health and wellness, how much are they saving by avoiding extra visits to the clinic for all members of the household, for burns, for possible malaria, for possible bites or other issues from not having a light and going out at night, from respiratory issues, all of that. And it came to $12 to $15 annually, I think. And again, all of these are estimates and translations. And we did that similarly for all of the different the second order effects. Those are the easiest ones to call out. The improved standard of living and empowerment, we're still digging into and trying to put numbers to. It's a bit harder, but was really powerful to see, if we look at all of that, how, what can the ROI of a light be? And it was, I think it came out to like 14 for social ROI impact, which is, if you add up all of the savings from kerosene, from additional revenue, from fewer health issues, and you take out the average cost of the light per household, it comes out to like a 14x impact, which is just ridiculous to think about.
Ridiculously good, you're saying? Or
yeah, absolutely.
Yeah, I mean, that becomes a compelling argument in my mind anyway. Sarah was talking about how a lot of the responses from civil society have been market driven and are sustainable. The argument is that they're sustainable that way. But this kind of impact is a real strong argument for the safety net model. Are there?
And can I just call out one more thing, Ben, while you were talking about those two models, the social safety net model that Let There Be Light is championing, and then the marketplace model that many of the other new initiatives are. One additional thing that we found from talking to these families was the level of sort of financial comfort and standard of living that they were able to achieve in just the year or two after bringing home a light with a newborn, and really basically experiencing all of these second order effects that we just talked about: financial wellness, education, health, standard of living, all of these things. By the time they finish a year or two with the light and are experiencing all of these benefits, they are now ready to take part now in a marketplace model. So that for us was a really powerful sort of journey of social mobility, because they went from truly bottom of pyramid to now, where can I buy another light? Can I save up for another light? Because it's had such an impact on my family. I want it for my sister next door, or I want it for my kids in the second room. And to see that not only they wanted more, but also that they were able to potentially afford it, or be, one rung higher on that ladder where they could maybe even save up for it, was really, really powerful to see. So as we talk about those two models, the social safety net and the marketplace, I think the social safety net is often given the criticism that it's sort of a one-time band-aid solution, and it's not actually getting the wheels turning. But with this one, it truly is creating this this very powerful mobility that then brings them up as from bottom of pyramid to real contributors to the economy, and that was powerful to see.
Yeah, thanks. So I see that we have another one of our partners in Uganda on the line. I'm not sure if the connection is good, but I'm going to invite George Mike. If you can hear me, and if you'd like to unmute yourself and add any comments or observations that you'd like.
Hi, everyone. I am
Yep.
George Mike. I'm glad to be listening to the discussion. Yeah, thank you so much.
Great. Good to have you, George Mike. If we welcome any comments from you, or we're a cozy audience today. It's a nice group. It's very manageable, and we have a few minutes left. So let's take advantage of that. If you'd like to add a comment, please unmute yourself. Frankly, the panel would all love to hear more about both how you what your thoughts are hearing about this program, what your questions are concerning how it works, as well as your work and the approach that you take. So I'm going to step back and welcome anybody who's willing to volunteer. Hello.
Yes, Ben.
Yes, please, go ahead. Is that you, George Mike?
Well, Ben, if we have some connectivity issues, were there any other questions that came through either direct message, Ben, or through the chat? And then maybe we'll give people a couple minutes of their lives back and wrap it up.
Sure. Well, I haven't heard. We have a comment appreciating the program, but thank you for joining us. If you're stepping out now, why don't we wrap it up? I think that makes sense at this point.
All right, I really want to thank everyone so much for your participation and for recognizing that maternal and infant health is it's a complicated question, but when we're talking about electrifying clinics, I hope people will also come away from this session remembering that then the new moms and babies go home to unelectrified homes, and it's really critical for us to remember that postpartum period as well. I encourage you to get in touch with Let There Be Light International if you'd like any more information about what we're doing, how we're doing it, and how you can implement it in your own projects or in your own professional or personal lives.
Great. Thanks, Sarah. And thank you, panelists. Thanks, Shreya. Thank you, Caroline. We wish everybody a great afternoon.
Thank you, Sarah and Ben, for all the great work you're doing.
Thank you. Thank you all.
Take care, guys.
Bye-bye.
Bye, Carol. Nice to see you.
Nice to see you too, Sarah.
Yeah, see you, Caroline.
Bye, Carol.
Bye-bye.